Many parents ask me an interesting and very important question. Doctor, can fever actually help my child fight infection? Or is fever always something bad that should be brought down immediately? Today, I will explain what fever really does inside your child's body, in a simple and reassuring way. First, let me tell you something clearly. Fever is not a disease. Fever is a response. When a virus or bacteria enters your child's body, the immune system detects it. White blood cells release chemical signals into the blood. These signals travel to the brain and tell the temperature control center, the hypothalamus, to raise the body temperature. So fever is not random. It is planned by the brain. Now, why would the body want to become hotter? Because most germs do not like heat. Many viruses and bacteria multiply more slowly at higher temperatures. So when the body raises the temperature, it creates an environment that makes it harder for germs to grow. At the same time, fever helps the immune system work better. White blood cells move faster. They recognize germs more easily. Antibodies bind to infections more efficiently. So fever is like turning the body into a battlefield where the immune system has an advantage. This is why, in many cases, mild to moderate fever is actually helpful. Now, parents often worry. If fever is helpful, should I never give medicine? The answer is balance. We do not treat fever just because a number appears on the thermometer. We treat fever to improve comfort. If your child is uncomfortable, in pain, not sleeping, or not drinking, giving paracetamol is helpful. It makes the child feel better so the body can rest and recover. But if your child has mild fever and is playing, drinking, and responding normally, it is often okay to observe. Now let me clear one big fear. Typical fever does not cause brain damage. Brain damage occurs only at extremely high temperatures, usually seen in heat stroke, not common infections. Another question parents ask is about febrile seizures. Febrile seizures happen because of a sudden rise in temperature, not because fever is helping or harming. They look scary, but most children recover completely and outgrow them. So how should parents think about fever? Think of fever as a tool used by the immune system. Sometimes we let the tool work. Sometimes we step in to make the child comfortable. What matters most is not the fever itself, but how your child looks and behaves. You should always seek medical advice if your child is very lethargic or difficult to wake, has breathing difficulty, has repeated vomiting, is not drinking or passing urine, has severe pain, rash that does not fade, or seizures, or fever lasts more than a few days. So let me leave you with this simple line. Fever is neither a friend nor an enemy. It is a response. Understanding this helps parents stay calm and make better decisions. If this video helped you, please like, subscribe, and share it with other parents. I'm Dr. Yatin Bhole.